Hey everyone, I'm Ed Harrold. Today I want to give you some tips on improving the length, depth, and pace of your inhale and exhale. And I want to give you a couple pointers in regard to how you can keep this upper airway open as you move through the challenges of your day. So step one is try to keep your shoulder blades back and down. So there's a lot of space between the shoulders and the ears, and it's really efficient for the trachea to exchange oxygen and carbon dioxide. Number two, release and relax the muscles around your eyes. Let the eyes rest back in the sockets. And this allows a fresh flow of blood and oxygen and energy to move through the two prefrontal cortexes of the brain. And number three, release and relax the low jaw. Separate your teeth a fraction of an inch. And breathing through your nose, allow the tongue to rest on the upper palate. The brain likes to see that. The respiratory centers of the brain love to see the tongue on the upper palate to promote optimal neurological activity as we move through our day. Optimal breathing 95% of the time always occurs through the nostrils, due to the fact that it creates a vacuum with the diaphragm on the inhale, getting the air into the lower lobes of the lungs, and your abdominal muscles or your exhale muscles, and this pushes the diaphragm up underneath the heart and lungs. And again, in the lung physiology, the bottom of the lungs are imbued with parasympathetic relaxation nerve endings, which are wonderful to the brain, the vagus nerve, serotonin, dopamine, all the things that keep us calm as we strive for perfection during the day. So length, depth, and pace. Keeping the upper airway open, breathing through your nose. Try to inhale 5% longer than you normally do, getting the air down into the belly first where there's no ribs, impairing the lungs expansion, and then take the breath up to the collarbone. Exhale through your nose as long as you can without straining. Notice the depth of the inhale as you take in 5% more. The depth of the exhale, how you give back 5% more and detoxify yourself from acidity, stress, wear and tear. Look at the pace of your breathing and how the pace of your inhale and exhale, and when it's slowed down in the physiology of the body, notice it slows down the film you're watching in your mind. Length, depth, and pace. Always try to inhale 5% longer than you normally do. Always try to exhale 5% longer than you normally do. This is called diaphragmatic breathing through the nose. Most of the time, when it's done correctly, this is a parasympathetic response, and it's wonderful for the autonomic nervous system, and it's wonderful for the personal growth centers of the brain, stalling aging. Another way of improving diaphragmatic breathing is to valve the air through the epiglottis at the top of your trachea. And if we can contract that epiglottis slightly, we can hear the ocean off in the distance in our ear, or we can hear the sound of space. To achieve this sound, bring one hand up to your face. Pretend this is a pocket mirror. Exhale into your hand. Try it again. Now, using your brain, try to identify where is that sound coming from in my throat. Identify it. Close the mouth. Now contract this area and breathe through your nose. You'll notice immediately the length of the inhale is longer, the length of the exhale is longer. You'll notice the depth of the inhale is deeper and the depth of the exhale is deeper. Notice the pace of your breathing is smoother. It's longer. There's more rhythm there. The brain loves to see that. So learn how to valve the air through your throat. Breathe diaphragmatically through your nose. And you'll be well on your way into optimal health. My name's Eddie Harrold. Thanks for watching. And as always, go be great.